Welcome to Untold Pleasure, the Cancer, Sex and Intimacy podcast. I'm Sarah.
And I'm Cheryl.
And we will be taking you on a pleasure-focused journey where we aim to end the shame, stigma and silence around cancer, sex and intimacy. Welcome to episode 5 of Untold Pleasure, the Cancer, Sex and Intimacy podcast. Today we're going to be discussing navigating cancer, sex and intimacy as a queer person. Unfortunately, Cheryl can't make it. We all know in the cancer community what a roller coaster it can be living with cancer, but she's with us in spirit and really wanted to be here today for the conversation. We are sending well wishes to you, Cheryl, and look forward to when you can join us on the next podcast. Myself and Cheryl thought this was a very important episode because a lot of healthcare is very heteronormative, and navigating that space as a queer person is loaded with so many other elements, especially if you don't see yourself represented in the literature or the way you're identified and spoken to in the consulting room doesn't align with the way you feel about your sexuality and your gender. So that brings me to our guests. We are joined by the wonderful Bima Loxley, who is a psychosexual therapist, and also Jennifer Crouch, who is someone with a lived experience of cancer. My first guest today is Bima Loxley, whose pronouns are they, them, and Bima is a brilliantly knowledgeable and open sex and relationship therapist who specialises in gender, sexual and relationship diversity. So we're incredibly lucky to have them on the podcast today. Hi, Bima.
Hello, thanks for having me.
So let's dive into a few questions. So please tell us what made you want to be a sex therapist and educator, and how did you get into that field, and how does it fulfil you?
So looking back, I think it just made total sense that this is the field that I want to be in, given that when I was 15, I was giving like friends advice on boyfriends and blowjobs and stuff, even though I probably knew nothing myself. But the journey was just quite random because I originally studied Italian at university and wanted to be a translator. And when I realized that's not what I wanted, I was in that kind of like stuck stage, living in London, working in a temp job. And it was actually another podcast, Sex with Emily, who made me just realize that, oh, you can talk about sex all day if you want to. Like, this is a thing. People do this. And then I went traveling, as you do, and one found oneself. And I realized, oh, I can do this. And I didn't think therapy would be the right path for me because I'm ADHD, I'm quite blunt, sarcastic. I find it quite hard to empathize with people at times. But actually, as I got into therapy and started learning it, I realized that not all therapists look the same. They don't look like the stereotypical librarian you see on TV. You know, they can look like me. And here I am now, several years later. And it's the perfect fit for me. And the sex educator side of it is just what I wanted to do outside of therapy for like general public and put the information that I have out there for people who can't necessarily access therapy or don't want to. So I use Instagram for that. To the part of the question that says, how does it fulfill me being a sex therapist and educator? I think that coming into therapy and actually recognizing that I can empathize once I put my therapy hat on and I can help people, I think it fulfills me when I see people learn what I already know, and also that I learn new things that people come to therapy with. Difference is just so wonderful, and embracing difference on my end and on a client's end, I think is so fulfilling. Like if I can help someone every day, which is what I do, or at least I hope I do, that's what's really fulfilling to me. So that's kind of like my journey into it. There are like specific ways one can become a sex therapist, and there are routes that you can go down, and a specific body called the College of Sex and Relationship Therapy, which is COSRAT for short. And that's the best place to go online if you want to sort of look into where to study, and also what therapists you can find there, because that's the directory of sex and relationship therapists, best place to go.
Amazing, thank you. And why is it so important for there to be options for patients and clients to have a therapist and support from someone who identifies as queer and or gender non-conforming? And can you explain what these terms mean for anyone listening at home who doesn't quite know?
Yeah, so I'm gender non-conforming. I also identify as non-binary and gender queer. And what that means is that I just do not align with the sex that I was assigned at birth. So sex is different to gender. So sex meaning male and female. So you're thinking the body parts, anatomy, what someone stereotypically looked like, although obviously we can challenge that because everyone looks different because we're all human. And gender is the identity that we have. So that can be changing and be fluid. And so I identify as genderqueer, which means I don't align with being female or a woman or a girl or the pronouns she, her. But that's just me. So everyone can be different. And some people fit completely outside of the box of being non-binary. And some people want to just transition their gender and could be identifying as transgender instead. Cis is just the Latin name for people who do align with the sex assigned at birth. And it's not an insult, it's just simply language.
Mm.
And I feel like it is important for clients and patients to have someone who identifies similarly to them. However, I don't think it's necessary because not everyone will always be the same as you because we're all diverse. To say that only queer clients can have queer therapists would be quite reductive because there are cis and het therapists or doctors out there, healthcare professionals who do understand and do get it and can help you because the knowledge that they have is enough. I think for me, when my clients are queer, we just connect because there's this kind of underlying understanding. There maybe doesn't have to be a lot of explaining of what certain terms mean, but someone who's cisgender or hetero can do the learning and do the extra learning so that they're queer knowledgeable. So I think it's a mix. Like, I don't want to put everyone in a box and say, if you're queer, you need a queer therapist. However, I am there if you need that. It's just that I feel like we're a rare breed. Finding queer therapists is quite hard, especially genderqueer, but we are out there. And obviously, if you want to come to me, I can send you in many directions of finding others if you and I don't fit.
Yeah, brilliant. Thank you. Yeah, I think it also comes back to the cancer experience is incredibly diverse as well. If we talk about different cancers and different ways of moving through the cancer system, there's so many different treatments. Like, that is an incredibly diverse experience. So what are the ways in which you think healthcare and sex therapy could intersect more? And how would you say sex and relationships link to overall health?
So for those who are allosexual, which means that they want to be having sex. So asexual are people who don't necessarily have attraction or want to be having sex. Of course, that's also a spectrum. But for those who do want to be having sex, that needs to be included, I think, in healthcare because it's almost one of the first things to go and the taboo topic that no one talks about. Because if you're ill, God forbid that you want to enjoy yourself and have fun and just sort of forget a bit that you're suffering. So I think sex and relationship health needs to be included because that is what drives a lot of us to thrive in life. So simple ways really could be a healthcare person just mentioning sex, like, hey, have you thought about the sex that you're going to be having during this difficult time, or how your relationship's going to be, because obviously there might be grief involved or loss or just a lot of pain. And so if you can have like a multidisciplinary team,
Yeah, that's it.
healthcare provider and therapies and sex therapies and relationship therapies, so that anyone can realize that they can get help beyond the help that they feel that they need in terms of cancer, but also their well-being. Sex is a human right. If you want to do it and if you want pleasure, we're entitled to it. So we need to be able to know that that's normal and that we can be looking for that help. So just working together really and signposting where necessary.
Yeah, I think that's so important. I mean, you've hit on like so many points that resonate with the cancer community. You know, it is this kind of feeling of being overwhelmed in an experience of sickness and, you know, maybe wanting to experience pleasure or perhaps being frustrated by a change in sex drive or libido or whatever that might be. But having those routes to pleasure and being signposted where necessary, and completely, sex is a human right. And yeah, it's wonderful to hear you say that. So what would be your advice to anyone listening who thinks doing sex therapy might help them but are scared to approach that world?
I think the first thing that most people say when they meet me is that they're nervous because they're opening up into a really vulnerable space with a complete stranger. So just know that it's really normal to feel nervous, but also that so far nothing has shocked me as a therapist. You know, you can come with so many problems or questions or concerns, and nothing has really shocked me. And I think that's simply because I see the human behind what they're bringing, like we call it the presentation that they're coming with. I would say just shop around. People say that therapy is like dating. So, you know, you're not going to find your perfect therapist on the first go. Interview them, have consultations, have an initial session, and then just see. Be honest with what you want and your experience and what you need and your boundaries, and especially like the specialities that your sex therapist has, right? Not all sex therapists, for example, are trauma informed or say cancer informed. So it's looking at what therapist is best fit you, and then be honest about your fear and your nervousness. You know, if you're scared to approach, then we can help you with that and guide you, and know that we don't need to dive straight in. We can just get to know each other first. Like, therapy is tailored to you. So the first step is finding the right therapist and contacting them. That's a really big, amazing step. And sometimes that's the step that we need to sort of just be able to like sink in a little bit and realize, okay, I am helping myself, and this is okay. This is really good. And almost, you know, let the therapist like hold you in that. But yeah, I really appreciate that. It's scary. Like, I have therapy. It's nerve-wracking, but that's really normal part of the experience until you create a bond and a connection and trust is there.
Yeah, it really is that. I think it's that thing of just being open to who might be the best therapist for you in that moment, isn't it? And finding those right routes and steps for yourself. And I know you run a wonderful Instagram account as well. So how can people find you online?
On Instagram at Loxley Sexology, Loxley Sexology. And my website is just my name, bimaloxley.com.
Amazing. And we'll put this info in the blurb underneath. And now I'm going to be talking with our second guest, Jennifer Crouch, whose pronouns are she, they. And Jennifer has had breast cancer, but is also an artist whose work often looks at the queer experience and how that intersects with the body and science. Hi, Jennifer.
Hi.
So please, can you give us an overview of your cancer journey and how it links to MRIs?
Yeah. I started doing a PhD in like a practice-based PhD, which is kind of art-focused, but my background is in science. So science has always been part of my creative practice. And I started a PhD in 2018 looking at the nature of corporeal matter. And I have previous experience working in a dissecting room as a medical illustrator. And so I got really interested in MRI because from a creative perspective as a practitioner, making the image is the doing of the science. So the creation of the image is kind of what the scientific practice is. And so from an artistic position, I kind of really wanted to look at the process. So what I did for my PhD was two main practices. There was basically making sculptures that would go into MRI scanners and kind of act as a body proxy and be made from materials that were basically tissue mimicking materials. And tissue mimicking materials sounds fancy, but it's basically anything that's like food. So like, you know, pineapple slices and gelatin and agar and water and cocoa butter and things like that. Yeah, so looking at that kind of body-machine interface and what happens on like a kind of quantum mechanical level with corporeal matter in the MRI scanner. And the other side of my PhD was another body-machine interface, but it was weaving. And I would take the data, so you have the analog waveform in the scanner, and that gets sort of taken apart and reconstructed and manipulated mathematically to create a representation of the inside of the body, which for me just seemed like absolute magic, that you can take an analog signal, like run it through some mathematical processes and then just like see a representation of the inside of the body. So yeah, I just was kind of really into this and thought it was a really beautiful way of superposing different experiences, like being a body, being a person, being part of a population, having feelings, having experiences, as well as being made of matter that is at base like quantum mechanical. So yeah, the idea of multiplicity is really present in MRI. And in the second year of my PhD, I was diagnosed with breast cancer. And so it became very much actually a matter of survival, really, because when I was doing my work, it was almost like coming to terms with my own bodily materiality and the fact that my own cells and my own matter was throwing this coup. And like, yeah, it took a different turn, basically, my research. And then it became a way for me to process what was happening to me, to come to terms with it. And actually, then COVID happened and my radiotherapy finished 2 weeks before the lockdown in March happened.
Wow, yeah.
That was very like a real like kind of having to reassess what my next 6 months were going to be like. But in a way, with the lockdown, it kind of gave me a chance to just completely give in to recovery and to healing. And yeah, so
I don't know if it's like the artist way sometimes to be like having a creative practice and wanting to understand your diagnosis through the practice of making, but then also needing that space to heal because you've just had a huge medical experience.
Yeah, I think it's a way of processing. It's a way of coming to terms with what's happening to you, but it's a way of being close to something and also having distance from something too, because there's an ability to have distance and proximity kind of to different degrees at different times.
So what was it like navigating the healthcare system as a queer person? Were there any particular challenges or anything that you felt could have been better?
Yeah, so, I don't have any complaints. I don't feel like I can complain about my treatment because I'm well enough, I guess, because that's all you can ever be is well enough. There's part of me that sort of doesn't want to complain about stuff, but I found it very strange when I first entered sort of the realm of the sick.
Yes,
This kind of world and this way of being treated and this way of prioritizing certain choices and being in a situation, with my lovely surgeon and lovely nurses where it's just like, oh yeah, so you have to make some choices. You need to freeze some eggs and you need to do this and you need to decide what kind of things are going to happen to you. And it's just like, actually what I really needed was processing time. And as a queer person, the way that AFAB bodies and women are like badly treated because of misogyny within society is a big aspect of this as well. There's certain other aspects to it where it's like expectations of particularly gendered or gender presenting bodies. There's also the fact that for a lot of people who are femme-presenting and who have a uterus, the assumption is, oh, well, because you have this kind of body, naturally, you're going to want to have a baby and you're going to want to have a family. And that might be what most people want, and that might be a very precious decision and important choice for them, but it's not what everyone's decision is.
Yeah.
So, and it's the same with, breast-conserving surgery, which is what they offered me. I just thought, okay, yeah, cool, we'll just go with whatever surgery you offer. But I don't think breast-conserving surgery was actually the right thing for me. And it's not because my treatment necessarily was bad. I think it comes down to actually giving people processing time to think about what they have to do. And I do remember my nurse saying, take your time and being like, but I can't take my time. So there's so much information and time and space, I think, that is needed to make the right decision for you in those kind of situations. I don't want to say bad things about the NHS. I don't think it's the NHS that's the problem. It's literally just about patient choice.
Yeah.
Logically, for me, and it sounds like a really cheap solution, you just ask the patient what they want.
Yeah.
And so I don't feel like I was given an option. I feel like it was the assumption was made because, for many people, it's like boobs and figure and ideas of femininity are, attached to certain aesthetics and certain forms and shapes of the body. And for me personally, it's never been how I felt as a queer person in a queer body. Like, why would I want to subject myself to the kind of pressures of like patriarchal, heteronormative aesthetics? This is what a woman has to look like. This is what a woman has to behave like. This is what a woman has to wear. You have to be like feminine in this very specific, narrow sense. And again, like I criticize the kind of power structures within that. There's nothing wrong with wanting to look like the Jessica Rabbit kind of figure. There's nothing wrong with wanting that. But I think we do have to be critical of the pressures within society that people are under. And I just feel like for somebody who is queer and queer in the sense of, I guess, like subverting categories within my practice, subverting categories within how I present myself in society, within how I behave, how I work, the kind of work that I do, there wasn't anything that I felt really fitted for me. But I wasn't really able to process this until like a couple of years after everything ended, really.
I think that's sort of why there needs to be that education kind of present and that choice, because it's like when you do have such a difficult diagnosis, like a cancer diagnosis, you're suddenly thrown into this world where you can't make those decisions, and you do lose a sense of agency. As much as we're signing consent forms to our treatment or whatever, but you do completely lose that body autonomy in a way.
Yeah, in certain ways, there's part of that loss of autonomy that within the midst of treatment, I tried to experience in my own way as an opportunity to kind of glean power and pleasure. Because there's something quite queer for me about this kind of poking and prodding and like extracting and like the boundary crossing of the body and the kind of like a breakdown of the self, which you go through kind of psychologically, but also materially it's happening within you. So there was something within that where I was like, this is an opportunity for me to question what I am as a body. And it's an opportunity which I think was mirrored in my research and mirrored in the artwork that I made. It was basically a way of getting power in these exact situations where you are so vulnerable. I remember like just before my surgery having this, it was like a wire-guided insertion thingy that they like kind of like stuffed into my breast, and it's like a little harpoon, and they harpoon the tumor and then they stuff this wire in your breast tissue. And I was like, it was the worst sensation in my life. And I felt so, but when I was having that wire-guide insertion thing, the person that was doing it to me was like, oh, do you have any children? And I was like, I'm literally about to go down. Like, why are we talking about this? Like, why aren't you checking if I'm okay?
It's quite a triggering question as well, isn't it?
Really triggering. And especially if I'd been the kind of person who actually wanted kids and then was not
going through a cancer.
Yeah, exactly.
Thank you, Jennifer. I mean, I think we're having an amazing discussion, so I really want to bring Bima back in at this point. And if you two haven't met yet, Bima's on the Zoom screen. Obviously, we are a Cancer, Sex and Intimacy podcast. So how did cancer impact your sex and intimate life? I mean, did it change over the course of diagnosis, treatment, and where are you at now?
Yeah, so there were various changes. So there were changes, obviously, with endocrine treatment and with Zoladex and tamoxifen. It affects the lining of the vagina. It makes it harder for, like, I had like fissures on my vulva, which was just literally from having less collagen. But I really felt kind of more horny than I'd ever been, really. And I felt like there's loads of things that did happen with intimacy in terms of my relationship with my own body and with being careful. So you have this kind of post-surgical kind of behavior where you like are naturally quite careful with yourself, and that can linger. But yeah, I felt like I really didn't want to be careful with myself within the context of sex. Like I wanted to kind of push through that because after cancer you do have health anxiety, I guess, generally. But yeah, I found actually that kink was very helpful with that, and blurring the lines between pleasure and pain was a really important part for my recovery and for being connected to myself sexually.
I guess the kink and the blurring the lines between pleasure and pain, is that sort of looking to the pain that you have a bit of a say over, or even if there isn't that say, but kind of being cared within that space?
Yeah, absolutely. It's a kind of practice kink that is centered around care. And there are so many people within the kink community that are looking for different things and exploring different sensations, different types of pain for all kinds of different reasons. And yeah, I feel like having control over what my body was feeling was the primary part of that process of being like, okay, if my body feels uncomfortable, it's okay. Like if I have a sore throat or a pain somewhere in my body, it doesn't automatically mean that I've got other cancer symptoms. So it was about, transforming something that was feeling negative into something that was feeling pleasurable. And the power to decide, the power to control that situation was, I think, really crucial. Yeah.
I think it's, I guess, within like the healthcare sphere, there isn't really that space to have conversations around maybe the sex you might want to be having or exploring. I mean, a lot of the literature is very heteronormative, apart from the Cancer, Sex and Intimacy pleasure booklet. But yeah, I'm going to put this question to both of you, but navigating a cancer diagnosis and when you enter the healthcare system and you don't really feel seen within that, unfortunately, we do have to kind of advocate for ourselves sometimes in those spaces. So how do we find the power within us to advocate for what we need? And so Bima, if I go to you first.
Sure. I mean, the first thing that comes to mind is solo sex, right? Jennifer, when you're talking about kink, I'm thinking kink doesn't always involve sex. So is it that you want to sort of unblur the lines between kink and sex and pain and pleasure as well? It's the hardest thing is to tell someone, what is it that you want? What is it that you know? And then come back and say, well, I don't know. Like my body's changed, or maybe I never knew in the first place. And in a cis heteronormative society, it's always about like the male being able to pleasure the female, right? So it's saying, actually, can we take our power back and look at our bodies in a different way? You know, you're talking about fissures on the vulva. I can imagine like, it like to get a mirror out and look at them and like explore them and understand them and see them as something that happens very naturally. It reminds me of like people going through menopause, right? It's this thing. Normalizing of lube, I think, could be amazing as well. Like, lube is used for everyone, specifically vulva-safe lube. You know, it doesn't contain glycerin, glycol, any kind of sugars in there, because otherwise you're going to just have an infection. So, but like if you went to solo sex or solo kink even and started exploring, what is it that I want? And have no goals, no expectations of like what pleasure could mean to you, even if it's just like a simple blissful moment. You were talking about kink, Jennifer, and it sounded very mindful how you're experiencing it, in that you were assessing what pain is what, and actually it doesn't have to mean something catastrophic. It can just be like a twinge or something else. And that sounded like a really mindful experience, which I think does involve kink. And I love the idea of care as well.
Yeah, I think there was a lot of wanking in my recovery. Like it was definitely like a daily, I was like, I'm doing this every day. And I was also on this like online women's cancer thing and being sort of engaged with that, amazing, beautiful community of people who were also talking about their anguish with intimacy and with sex, and then just being like, guys, just like, go see a femdom and like, get yourself beaten up. And, I kind of didn't even feel like I could really articulate that to them because I felt like these guys aren't going to be interested in this. But looking back, I probably should have suggested it to them.
Yes. As soon as one person starts talking about sex, or like I have endometriosis, and as soon as I start talking about that, someone was like, oh, me too. Oh, I have painful sex. Oh, and it's permission giving that if one of us talks about it, then we just sort of destigmatize it a little bit more and more every day.
Yeah, totally. And I think that, you were talking also about like kink that isn't with typical sex or like touching genitals and it still being kind of sexually pleasurable or tapping into something really, really profound within you. And actually there's so much within like the psychology of surrender and like, for me personally, like humiliation that is really fun and exciting. And like when I think about humiliation, I'm thinking about it in terms of almost like a clown or almost like having a ball gag in your mouth and then just like drooling uncontrollably and then being blindfolded and like tied to a bench and like skidded across the floor in a dungeon. And this being like, yeah, like this is what I want. I want to get lost. I want to lose myself and just being completely within your body and within sensations. The dom that I was seeing, she was just like, you have to clean up all of this drool, because I'd like left this pool of drool like all over. And I was like, oh my God, yes, ma'am. And getting on my knees and just like that specific event that I just described was surrender and fun, really, and freedom. And there's no expectation. And it's okay if you look silly. The reason why I went in hard for it was because of that feedback of that liberation that it gave me and that sense of corporeal release that was like, really necessary.
I think cancer can kind of give you the permission to live a side of yourself that maybe you weren't giving the space to before.
Yeah, changing your priorities and really saying, okay, you can, especially if it's like, yes, you can live. You can live for some more time. This thing happened to you that was going to change everything and it has changed everything, but you actually have more time, that permission to be like uncompromising in what your desires really are. it makes you change your priorities. And that looks different for every single different person that has this experience. Yeah.
I wonder if it's also about like deprioritizing cancer at some point as well. Because if that's all you've lived and been living, it's saying as queer people, right, that's also a label that we have and something that we want to embrace. Or as a sexy person or a kinky person, it's saying, I am not just cancer, I am all of these other things. And in a certain space, when you're talking about like your dom just saying you need to clear up your dribble on the floor, what she's doing is like humanizing you and saying, this is what you're doing, instead of treading lightly and treading on eggshells around you for a diagnosis that you have, when actually she's seeing you for the kinky human that you are.
This is exactly it. It is completely, because it can take over, and it's not wanting to see myself as this like fragile thing, but wanting to really see like, I've been through a lot and I'm kind of battered and I'm kind of like, whatever, I've got like fissures on my vulva or whatever, but actually I've been through a lot and I've survived a lot, and I don't have to be precious. I can take these kind of risks and put myself in these kind of situations and get like a completely bruised butt and be completely like delighted by the fact that I can't sit down properly for 2 days. And it's not, I don't want for people to think, this is crossing into self-harm. And I think that's a whole like other kind of bag of things that is kind of, needs its own conversation. But going back to what Sarah was saying about taking control of where the pain is coming from. And I love what you said, Bima, about it's my dom humanizing me, because that's exactly how it felt. No one pussyfooting around me or kind of treating me like I was very breakable. Like people treating me like I'm strong, because I am.
Yeah, there are people say that aren't, or at least they are strong, but they don't need kink or don't want kink as well. It's like, I think I'm wondering about the people who are like, okay, I'm not into kink at all, and actually I am very delicate and I do hurt. I need a lot more care in a different form of maybe worshipping instead.
Yeah, totally.
Having a sub underneath you, but like looking at that variety and how kink can be one end of the spectrum, which is so amazing and like really should be embraced and understood and talked about more, but also the idea that some people don't want that, and vanilla is also wonderful, yummy, sexy.
A lot of what people can take away from this discussion is that it's about experimentation, finding those new routes, and whether that is gentle steps to just like reacquainting yourself with how your body feels, like the sensuality of the skin and sensations, and gentle steps towards intimacy, either if that is solo or with a partner. So I suppose what could be those kind of gentle steps someone could take to reacquaint themselves with their sensual self?
Like the immediate one goes straight back to solo sex of like, just can you take a mindful moment? So that doesn't mean meditating per se, but sort of just being present with your breath and focusing on the senses of your body. Can you do a full body scan with your fingers or a feather or an ice cube and really explore, like, where is it that really feels great? Where does it feel quite painful? And where does it feel neutral? And like explore your whole body beyond just genitals and chest, right? Like, where are your new erogenous zones? And I'm not saying it's easy. It takes time, right, to be mindful and in touch with yourself. But you can also ask, if you have a partner or partners, to have them explore with you too, so long as consent is involved and they're not touching you in places that you don't enjoy. Maybe taking sex off the table completely and just exploring what it is to be sensual and intimate with yourself and with others could be a really good place to start. But I'm even like rewinding back to that. It's like some people don't even enjoy being naked or don't like their body that has now changed. And it's saying, well, put on underwear, put on a t-shirt, put on a binder or some clothes that make you feel comfortable, or wear something like sexy lingerie that makes you feel really good in yourself, or listen to some porn, or watch some porn. It's really exploring it, and maybe using Google and talking to your friends could be a really useful way to sort of just broaden that horizon.
Yeah, there are so many possibilities. And this is why I think queerness or queering is like so powerful within some kind of methodology of processing trauma in this kind of way and processing disease in this kind of way, because it is about subversion of certain categories and expectations. And it could be anything. It could even be like in your pajamas is your like sexiest kind of feeling, like with a hot water bottle under a duvet, with like a soft blanket over your head. Because the thing for me, which is very profound about kink and surrender and all of these things, is just this contact with what I am as a body and as like neurons and as feelings and memories and connections with people. So that could be anything. Because I think if you really break it down to what is it about sex that is good, what is it about intimacy that is good and that is important, and it comes down to those which could manifest or be created in so many different kinds of ways. But yeah, I think creativity is, and also like getting rid of the idea of kind of shame, like, oh yeah, well, it has to look a certain way, it has to look within this particular kind of normative vision of what sensuality and sexuality has to look like. It can be pajamas under a duvet.
Yeah, brilliant approaches there. And it's such a wonderful world that we can explore. And I think shame, stigma and silence is something that is a very universal thing that people living with or beyond a cancer diagnosis experience. And, Bima, like you were saying, it's like the second someone brings it up, it's like the floodgates are opened and sex is suddenly on the table. Or well, not right now. But, it's like you can just start talking about it and it's okay, it's exciting and you can learn from each other. I just want to bring it to, because a big part of cancer treatment is often hormone treatment is involved, and experiencing that as a queer person may be layered with other elements such as heteronormative assumptions around hormones and what that could do towards body dysmorphia and feelings within your body.
Yeah, I think body dysmorphia is something that's very present with people who I think are cis, and then they have like the surgery and then their bodies change. So I think for me, there was definitely euphoric elements of my endocrine treatment. There was the medically induced menopause, which for me was like, this is the body that I belong in. I belong in a body that doesn't menstruate. And I felt so at home there. So it was almost like the end of treatment. It was like, my periods are completely erratic. They're kind of coming back and they're kind of like, they're just like, surprise. And then it will be like complete carnage for like 2 days. And then it will go away for like 3 months and it will come back and it will last like a week. And it's completely, it's all over the place. And I'm still on the tamoxifen. And a lot of people will struggle with the tamoxifen. And I know it sounds odd, but I've felt really at home with that treatment. And of course it's had side effects that are negative. It's, gives me like these other dermatological kind of issues. But I kind of embrace all of that as there's something kind of for me like really non-binary about it. It positions my gender and how I feel about my body within this space where it's like, yep, nope, can't do that. Yep, nope. And it's this sort of power of refusal, which I think for me was really great, and which actually coming out of treatment, I'm actually losing that. I know it's not going to be everybody's experience or everybody's opinion, but it is an experience. Yeah, I don't know, as a non-binary person, that for me was really liberating.
Also wondering, for people who are going through hormonal transition, like genderqueer people, like, can cancer stop that or cause issues? So if someone is on testosterone, again, I'm no doctor, so I'm not sure what cancer treatments are going to change what kind of hormone treatments, but do they clash, right? And I think it's that idea of someone is going through this kind of transition, the doctors need to be aware of that and not just say, right, this is the kind of journey that we're going to go through. These are the kind of medicines and treatments you're going to have, without the acknowledgement that that could really affect someone's gender journey, and that then could lead to dysphoria, right? So it's like going to the flip side. When you started talking about like the ideas of different kinds of top surgery for cancer treatment, I thought that would be so freeing for some people, but then I guess for others not. And I think it's about recognizing the diversity. And it's so nice to hear, Jennifer, your experience of how like you found and you came into your body, and although it's changed again now, it was that like idea of like, oh, this is what it could be. And I really like that kind of acceptance, that it sounds like you're accepting that it's changing, but also hear like a little bit of frustration in that, like, I found it.
And now it's gone. And I think it's an important observation to make, that loss, of that kind of like gender euphoria is also connected with the ending of treatment. And then you lose that kind of care. Where it's just like, go on now, you're fine. Come back next year for your mammograms and your MRI scans and your bone density scans. Come back later for those, and then it's I think it's wrapped up in other sort of types of loss within the treatment journey. But I think what you're saying applies to like a much bigger issue. And again, it all comes down to patient choice. And each patient, whether they're cis or trans or heterosexual or whatever, like it's just about patient choice, asking the patient what they want. So I spoke to somebody. They were somebody with the BRCA2 mutation who was transitioning. I think BRCA1 or BRCA2, I'm not sure which one, but they were on testosterone and they were just like, this is really uncharted. Like there's not really any research on how this could interact, with BRCA1, BRCA2. But there is research on how contraceptive pills interact with that. So again, it comes back to this like, if it's about controlling the production of babies, we will investigate this. But if it's about freeing yourself from this gender binary, then it's like, well, there's not enough people who are doing that. So we're not going to put any money into researching it. And then it just feels like, okay, so then you're just going to like condemn these people to like oblivion because they're a minority. Like it seems so bizarre. It's like if people are doing this, then that in itself warrants research to see what the interactions are, because otherwise it is legislating people into oblivion.
And that's it. If your experience isn't being researched or questioned, then you can feel lost within an experience. Like, where do you find the answers then?
Yeah, totally.
If they're not kind of medically researched, they're not available online. Again, it comes back to community, but there's only so much you can do without that kind of hard scientific space.
Yeah, totally. And it just comes down to patient choice. Like I wasn't offered mastectomy or top surgery. That would have been great for me. Like I would have really wanted that. And I still want that for my body. And then I remember after having my radiotherapy being told, if you'd refused radiotherapy, we would have given you top surgery. And I was like, well, then just give me top surgery then. Just give it to me. Like it was always on the table, but you just gave me the one that gave me the body that you thought was most typically femme. And I just feel like, again, like absolutely got all the love in the world for the medical professionals that worked with me, but it's just about being like, here are some options, lots of options. You can do this, you can do that, you can do this. We don't necessarily have to do breast conserving surgery, although most people your age and whatever with your physique kind of want this. And it's just like, most people is important, but it's not everyone. If you want a more equitable society, it's about acknowledging that difference is real. Everybody is equal, like the law in terms of their value, what they can offer in society, but not everybody is the same. If you pretend that everyone is the same and you give people the same options, then there's a lot of erasure that kind of comes with that.
This is such an amazing discussion and so important. But just to wrap it up, do you have any advice for listeners who identify as queer and are about to start cancer treatment or have just received a diagnosis? I mean, we've touched a lot about choice and advocating for the self, but what are the kind of maybe the practical tips that someone could take to the consulting room?
I guess like not everyone has the ability to do the research, right? Jennifer, you've already mentioned community. I think it's about going straight into the community if you can, of like, whether it's a cancer community or a queer cancer community, talking to others who've had this experience and getting the knowledge that they already have. I think it's about informing ourselves, right, of what is going to happen. And even if you're not queer, it's the exact same route. It's still finding people and a way to maintain that autonomy in your body and really figure out, like, what is it that I want, right? A pros and cons list of top surgery, for example. Right? Like, what is it I do not want to lose? And what is it that I want to gain from this? And can you seek therapy at the same time? Like, it's not always affordable, but if you can, it's saying, can you get that like mental health support? Because obviously this is a physical thing, cancer, but it does affect the brain and the mind and our emotions. So it's kind of looking at the holistic side of covering every base that we can think of, and listening to this podcast and getting these ideas, or going on a blog, which I'm sure there are plenty of. It's like the internet is at our disposal. So using what we have around us, but also being aware that we don't necessarily have everything around us. And so being able to find that like agency and asking the question, hey, I need some help. It's not shameful. It's actually human nature to want to ask for help, I feel.
Yeah. And I feel like finding community is really important. But I at the same time as that, I think it can be really overwhelming when you first get a diagnosis and then you're like starting to look online And there's just all of this stuff and so much speculation. And I remember finding forums and looking on forums and just being like, no, I need to not have anything to do with this. And then finding people, like physical people, which isn't always possible when you're having cancer care, but finding community to share these experiences with, and through that community, developing a kind of language or a kind of skill set in advocating for yourself. So it happens over time, and that's kind of the thing that's kind of clashes against cancer as an experience in a way, because sometimes you don't have that time, and sometimes you have to make decisions, or you're made to feel like you have to make decisions really, really quickly. So, yeah, I guess
improving the system, right? Like, why is it down to the patient to do the work? Is it actually that it needs to go up above into the system and trickle down the information, instead of us having to like climb up a really difficult hill because you're already going through cancer and like facing grief and loss and fear? Like, we need everyone to help us, instead of being able to. It's both, right? It's helping ourselves, but also knowing that we can look up and people can help us.
Yeah, absolutely. But again, that's the problem with having a blanket approach to treatment of cancer generally, and to having like, well, this is what your body is like, so this is what we're going to give you. This is what we've decided is best for you. And it's like, well, I wasn't consulted on the other options. My queerness wasn't taken into consideration. Being non-binary wasn't taken in, although, loving being femme presenting, like, doesn't get taken into consideration. Like anything that isn't this very typical way of being. So, and again, it can be very simple, because it's just about talking to the patient and asking them what they want. And that does mean that doctors and consultants and oncologists and nurses have to be aware of that. Whether they like it or not, they have to be aware of that diversity. You get like assigned a nurse who, will, I guess they assume, understand you. And I guess there's, that kind of layer of filtration that kind of happens within your treatment as well, I think.
Yes.
Yeah. So again, it's taking the time to literally. And again, like, I can't stress this enough, because it's not a very expensive solution. Like, just asking patients what they want.
Just ask. It comes down to that. And there is a lot of missing questions in the cancer consulting room, unfortunately. Yeah. And fundamentally, the cancer, sex and intimacy question barely ever comes up. So I suppose maybe, Jennifer, I'll put it to you, like, what would have you liked to have been asked? I know you've talked a lot about choices within surgery, but are there any other questions that you felt were missing?
I think it's emphasis as well as questions. So I would have liked to have had more surgical options given to me. And like I said, I don't want to complain, because I'm alive, and like, I loved them all. They were gorgeous people. They cut all the cancer out of me, took out all the lymph nodes. Great, like, lovely. It's hard to talk about, because you don't want to be ungrateful for it. But yeah, I would have loved to have had more options. I would have loved to have had mastectomy as an option, and not as an option that's like, well, losing your boobs is degrading and it's going to make you feel like bad about yourself, and being like, no, that would have made me feel really good about myself. Like, actually, that was something that I personally wanted. It's not what everybody wants, but ask me. So I would have liked that. I also would have liked it if there wasn't so much anguish over fertility, which for me is not something that I've ever been interested in. I think that would have been a really great thing to have involved in it. And I think also surgeons, doctors, oncologists, consultants, just taking queerness seriously, just in the same way that somebody who wants to have a baby, whether they're queer or non-binary or trans or like a cis woman or whatever, whether they want to have a baby, that is going to be taken seriously. But I would like for that kind of, and again, it comes down to patient choice and not to averaging everybody out with this really pointless, like, statistical tool that gets rid of all nuance. Averaging is a bad thing to do in treatment.
Yeah, definitely. Thank you. And Bima as well, coming from the psychosexual therapy side, it's a different world. But to a healthcare professional who's dealing with the kind of physicality of the body, what questions specifically relating to cancer and intimacy would you kind of like patients to be asked in that space so they have the permission to take their journey further if they need to?
Yeah, I guess the first question is, do you want to be having sex, right? The assumption that everyone wants to be having sex is one end of the spectrum. Also, the assumption that no one has sex because of going through cancer. It's that idea of, can we not sexualize, but can we bring sex back on the table as an option? Like, because all of these treatments and like the pain that you can get in your vulva or your penis or wherever it is that you have sex, because obviously it's not all genital based, can be affected. And if you can talk about it from day one, saying, do you want to talk about sex, or do you need some sort of signposting to talk about that? Yes or no, or do you want a leaflet so that you can look at it later? I think that's what I hear most from people who have had cancer, of like, that's just being completely ignored and saying, well, no, I'm a sexual being and I'm not going to lose this, and I might lose it for a while, but maybe I want to pick it back up again.
Yeah.
And the second it's talked about in that room, the permission's there. Passing the dildo. So, Jennifer, I'm going to pass you the dildo and ask you, what is your favourite way to create intimacy that is not in a sexual way? And this can be solo or partnered in whatever way you want.
My favourite way to create intimacy. So my favourite way to create intimacy is, I guess, through honesty and through talking. Like, I'm completely serious. I have a spreadsheet on what I want and what I don't want, and on my kinks. And actually getting the spreadsheet out for me is like, right, so this is what I'd like and this is what I don't want. And it's the sexiest tool that I've got. But also, like, over the past year, I've been really into like play fighting. So I've really enjoyed that kind of exertion. And I'm not a very strong fighter, but I like surrender. And so I'm very into being squashed. Yeah, sat on by multiple femmes, please.
Amazing.
So yes, non-sexual fighting, contact, pushing, pressing, compression. This is something that for me has been a fun thing to explore.
So, Bima, I'm going to metaphorically pass you the dildo through the Zoom space.
When I like first heard the question, I was like, what is a non-sexual way? Like, what is sex anyway? How do we define it? Because how all three of us define sex will probably be very different. So it's the world. So first of all, I just sort of open up curiosity for the meaning of sex. But for me, I think kissing, actually, because it's the first thing to go in any relationship, usually. And it's one of the things that actually create the same kind of hormonal wonderfulness as sex that kissing can do, which is so simple. And especially if you're doing non-demand kissing, which means you're kissing for the sake of kissing and it's not going to lead to anything sexual. Of course, kissing can be sexual. But I would say, like, if you feel like you want to connect, go do a long, healthy smooch with whoever it is that's consenting also, because you're just going to get those tingles in your jingles.
Yeah.
They're a powerful place.
Amazing. Thank you. And I've answered this question quite a few times now, so I'm having to like think of so many favourite ways to create intimacy. And Bima, I want to copy yours. And also, I like the sound of the squishing from a dating perspective. I do really like the pressure of someone lying on top of me. There's something about the weight of someone's body and feeling that and kind of like letting your breaths come into a synchronicity. And even when they fall asleep on me, that's even better. And it's just this, a really lovely intimate space that I can enter when doing that. Thank you so much, Bima and Jennifer, for that absolutely enlightening conversation. And I can't believe that next week is going to be our final episode. So we are going to be joined by Dr. Eleanor Holloway, who is an NHS psychosexual therapist. And we're also going to have some wonderful listener input. So please join us for that. And thank you for listening today.
You've been listening to Untold Pleasure,
the Cancer, Sex and Intimacy podcast. Please like, rate and review this podcast because that is the best way that we can get this far and wide to the cancer community.
Please also follow us on Instagram at sex_cancer_intimacy or drop us an email on cancerandintimacy@gmail.com.
And keep passing that dildo.